Meningitis, as defined by Medline Plus, is a bacterial or non-bacterial infection that causes inflammation of the membranes covering the brain and spinal cord. Today, I will inform you about the meningococcal meningitis, a specific type of meningitis caused by the bacteria Neisseria meningitidis. Some of you may not know about meningitis. By listening today, you will gain information about this contagious disease. While some of you may know about meningitis, by listening you will expand your knowledge about this specific type of meningitis. I have read multiple books, articles, and medical brochures about this topic, and I personally nearly lost one of my friends back in 2007 to this disease. Today we will look at the risks of contracting, the symptoms, and the prognosis of meningococcal meningitis. Let's begin by talking about what increases your risk for contracting meningococcal meningitis. According to the book Bacterial Meningitis by Alan Townkel, there are many factors that can increase your risks for contracting meningococcal meningitis. One factor is living in close quarters, such as dorm and military barracks. This is because you live in such a confined space with another person. Other activities that occur in crowded places, such as concerts and festivals, can also increase your risk. Activities that would decrease your immune system or weaken your immune system, such as lack of sleep or a poor diet, and sharing of personal items, such as toothbrushes and cups, can also increase your chances of contracting meningococcal meningitis. And that's because meningococcal meningitis is spread through mucus droplets. Finally, the geographical area in which you live or travel can increase your risks of contracting this disease. There is an area called the meningitis belt located in Africa, which has a high epidemic rate of meningitis. So that is an example of one of the areas that you could increase your risk of contracting this disease by traveling to. While it is important to know the risks, it is also important to know the symptoms of meningococcal meningitis. According to WebMD.com, meningococcal meningitis has symptoms that are both flu-like and non-flu-like. The flu-like symptoms include a sudden onset of a high fever, nausea and vomiting, severe headaches, and an overall ill feeling, but to a severe extent. There are also non-flu-like symptoms, such as a very stiff neck, rash, and light sensitivity that are very popular in patients. Patients can also have mental status changes such as disorientation and the inability to think clearly. They may also have seizures and purpura, which Merriam-Webster Dictionary defines as any of several hemorrhagic states characterized by patches of purplish discoloration resulting from an exacerbation of blood into the skin and mucous membranes. It is like a rash, but more purple in nature and spotted throughout that doesn't really itch. Now that we know the risks and symptoms, both flu-like and non-flu-like, I will tell you about the prognosis of somebody who contracts meningococcal meningitis. Prognosis for meningococcal meningitis, or possible outcomes of this disease, vary greatly from patient to patient. According to the CDC, less than 15% of patients die from this disease, and according to the World Health Organization, 5 to 10% of these patients die typically within the first 24 to 48 hours. An additional 15% of survivors, according to WebMD, which was last accessed on July 2nd, 2014, have lifelong ramifications from their disease. These can include, but aren't limited to, brain damage, deafness, muscle paralysis in multiple muscles, emotional and psychological problems, and myocarditis, which is an inflammation of the middle layer of the heart wall. Some patients are lucky and have no complications past their illness, which was the case for my friend Clinton back in 2007. By having an increased knowledge about meningococcal meningitis, you will now be able to react quickly in the case that you or a loved one ever contracts this disease. Today, I provided you information about meningococcal meningitis, a specific type of meningitis caused by the bacteria Neisseria meningitidis. Meningitis, as defined by Medline Plus, is a bacterial or non-bacterial infection that causes the inflammation of membranes covering the brain and spinal cord. Don't be oblivious, respond quick to meningitis.